Hi, in this lecture, we're going to close out the nervous system with a few more clinical applications. So we're back to talking a little bit about pain again, and there's two phenomena that are kind of interesting. There's something called referred pain, and referred pain is when you feel pain coming from an uninjured part of your body, where the pain actually comes from another location. So think of it, the pain is referred in this other area, and it's not that area that's actually damaged. This tends to happen with visceral pain, so when we're looking at pain from organs. There's a couple thoughts for this. One thought is that information from the skin, usually those dermatomes we looked at, those specific areas of the skin, that they often bring information regarding pain, and that information comes in from the organ as well. And so you have this information kind of coming in and overlapping a little bit, and a lot of times it'll radiate along the entire dermatome as well, instead of just being like a specific location of exactly where the organ is. Other thoughts are that interneurons get oversensitive with the information coming in from the organ, and those interneurons become activated, and then they send basically misleading information up to the primary sensory cortex. You don't have to memorize the exact cause of it. I just want you to be aware of it. In this picture, you can see where different organ pain might manifest. So often a heart attack, a patient will say that they feel the pain up in their left arm. It might radiate down their arm. Sometimes they actually feel it up in their jaw or even in their back as well. We know that appendicitis pain usually starts right around the belly button, right around the navel first. Then it goes down towards the appendix and the lower quadrant. And you can just see some of the main organs and where the pain radiates or where the pain might be referred to. The other thing is called phantom limb pain. And so phantom limb pain is just what it sounds like. You have a limb that's been amputated and the patient has pain or feels like the limb is still there. They don't know exactly what causes it. There's something going on with the nerve endings where the brain is still perceiving, a limb or something being there. So they think it's kind of like the brain remembers the previous pain, because if you have significant pain before the amputation, you're more likely to have the phantom limb pain. There can be things like numbness, tingling, I've heard itching, pain. So there's all sorts of signals coming in. And so one thought is that when the limb is gone, that area, that somatosensory cortex kind of needs to fill it in. So it tends to fill it in with these irritating sensations, which is why, kind of interesting, they have what we call pain, like a window pane or mirror therapy is used a lot to help treat it. So what happens is, the individual is missing their limb, but if you put a mirror up and they exercise their good leg, the brain sees the mirror image moving and thinks it's the amputated leg. Kind of interesting, but they've had a lot of success with that type of therapy. Now, Bell's palsy, you might have heard of this before. This is usually an infection or inflammation of the facial nerve. Remember cranial nerves, when you went through your cranial nerves. Do you remember which number? Cranial nerve 7. And so it can come on suddenly or over a slower period of time. A lot of times it's due to having a viral infection. For whatever reason, the immune system gets hypersensitive and then it starts to attack the facial nerve. So it might come after some sort of viral infection. It can happen from severe stress. Well, remember that nerve innervates, one, salivation and tears. So the eyes might get really dry. You might make less saliva. And if you have less saliva, you won't taste your food as well. The reason why drooling could occur is that you get paralysis of the facial muscles. And as those muscles, basically become limp, then obviously you might not be able to swallow your saliva. It typically goes away on its own. It can usually take a few weeks to a few months until it resolves. Another cranial nerve injury is called trigeminal neuralgia. Now, your trigeminal nerve is one of your biggest nerves, right? Trigeminal has 3 branches, and you can kind of see here. This is supposed to be excruciating. It's inflammation, some kind of problem with that nerve. They don't know a lot why it happens. It's more common if you're a female and as we get, 40 to 60 years of old, but it happens in elderly people who are older as well. What happens is it's a horrible, horrible pain that hits in your face. It's through this trigeminal nerve. So it can be extremely, extremely painful and debilitating. Also, very anxiety provoking if you never know when you're going to feel like you're getting an electric shock in your face, right? So, it can be pretty bad. The ALS, you might have heard of, amyotrophic lateral sclerosis, or Lou Gehrig's disease. This is a degenerative disease. So what happens is the motor neurons slowly degenerate in the brain and the spinal cord. And when they die, you lose control over muscles. So what will happen is individuals will slowly become weaker. Paralysis eventually moves toward the torso, and then unfortunately death will occur when that diaphragm becomes paralyzed. You might know the physicist Stephen Hawking. He also had this disease. And this disease is pretty nasty because it's the motor neurons. You can see how the neurons damage and degenerate. Now all the muscle atrophies and becomes very weak. So the brain is fine. So unfortunately with this one, the patient knows what's going on. It starts with minor muscle coordination and muscle weakness. And then eventually the person will be in a wheelchair. And then ultimately death will occur. So, as far as causes, there's a genetic piece to it. I don't know if they know exactly what could cause this disease. They do know there's some environmental factors as well that can cause ALS. And right now there's no cure. And then spinal cord, right? If we have any kind of damage to the cord, that's going to interfere with the movement of information up or down. And so spinal cord injuries, right now they don't really heal. They're working on stem cells and different treatments, but most of them are going to be due to some sort of motor vehicle accident or a fall. You do get some in violence and sports as well. But depending on the damage, you can have different terms for it. So hemiplegia is paralysis of one half of the body, not as common as paraplegia or quadriplegia. So paraplegia, it's usually the lower half of the body. So the damage is lower in the cord and therefore it affects the lower half, where quadriplegia is where the damage is higher up. So now you're going to have issues with all four limbs. If it goes up high enough, so it cuts off that phrenic nerve that goes to the diaphragm, now your patient has to be on a ventilator because they won't be able to breathe. And this is just some trivia or background information about some spinal cord injuries. So this is it for our clinical piece.